I'm Christian Howell. I'm one of the managing partners and a nurse clinician and have lots of experience as a master nurse injector in the dermal filler and Botox world. Today we're going to talk about the difference between what is a lip flip and what is lip augmentation. A lot of patients come in and they really don't know what they want. They've been on social media and they want something fast right away. How I approach the lip is one, I really look at the face as a whole and try to determine really what's going to make them look better. A lip flip is accomplished with Botox, which is a neuromodulator. Our lips are a muscle called the orbicularis oris, and these muscles contract and bunch all that skin. So a lip flip is me in a very light dose, injecting Botox in the upper lip to get it to stop contracting. The reason we do that is if this muscle is not moving, it can potentially look a little bit fatter or pouty or just a little more full. But what we can is just lightly putting a little Botox in there just to kind of get that muscle, one, to drop down over kind of the teeth a little bit, but it just kind of inverts or flips that lip out and makes it look a little more poutier. It's kind of fun to temporarily try a lip flip to see what your lip could potentially look like with a little volume in it, but I always tell people for the money it's not going to last that long, so I always try to educate them on the difference. Now when people say they want a more fuller lip or they want their youthful lip back, it's dehydrated, it's just depleted. This is a muscle. We've got a fat that lays on top of that muscle that is now starting to deplete, which makes the lips look very dehydrated or very small and just kind of deflated. So how I view the lip is I want to come in and support that muscle, give them that shape back. And once I do that, it almost like your lip magically reappears. It also depends on what your goals are. But lip fillers can last, depending on which one I'm using, 9 to 12 months, as opposed to a lip flip that may last 4 to 6 weeks. The best way to decide what is the best way to approach what is bothersome to you is just to come in for a free consultation. Like I said, it's not me just putting a needle in and filling it up. I'm actually laying little threads depending on which way I'm trying to get lift and shape. So it's like I'm trying to create that sculpture. So at the end of the day, I have to be happy with myself and what I'm designing, because these people are walking around with my name on their face for everyone else to see, and they have to be happy, because if they're not happy, I'm not happy either.